for this session. Welcome. I'd like to ask, probably they did this yesterday, please keep questions to the end of the presentation so that the presenters can get through their material. But I would like to welcome Lara from Purdue Northwest and have her introduce her presentation and her team. Thank you.
Hi everybody, good morning.
Good morning.
My name is Julie and this is Sheila and Trina. Good morning.
Good morning, Rebecca.
And Rebecca. And we're all senior nursing students graduating in May. We're from Purdue University Northwest and a couple of us are from the Honors College as well. So our project is the mobile clinic model in the context of Gray, Tennessee and Northwest Indiana. So just an overview, we're going to discuss the purpose and use of the International Community Assessment Model, as well as talk about the mobile clinic model, specifically Remote Area Medical, which is the organization that we worked through. Explore the student perspective of student learning in the community, and we'll all do a group activity at the end. And since it's an intimate group, it'll be a little more interactive, I think, and we'll be able to bounce a few more ideas off one another. So again, just to give a little background, this was an honors capstone course, and with our honors capstones, we're allowed to pick what project we would like to do, and they encourage service learning. And so when I heard that we could potentially go to remote area medical, I jumped on that opportunity and wanted to create a project out of it. So what we did was take the ICAM model, which Rebecca will tell us a little more about. We took that and assessed the community and then used remote area medical as the intervention to meet the community needs. And we used video to interview stakeholders to see who's in that community who could really make a change and leave a lasting impact in that community. So, Rebecca, would you like to tell us more about that?
So the ICAM is the International Community Assessment Model, and it's defined as a collaborative model for community assessment, for delivery, and education. And so the tool is used for the purpose of identifying community needs and also gathering data regarding community issues. So ICAM promotes community empowerment by using stakeholders from the community to collaborate alongside with the community to identify those specific needs that they need. And then they also create a culturally appropriate plan, and they provide feedback as well. They know best because they live in that community. When community empowerment methods are not used, interventions typically fall when the experts leave. So using community kind of as a catalyst to continue that intervention to create lifelong changes. So the ICAM is this circular kind of spindle tire looking thing that has different areas of assessment that they use. So first they look at spirituality, so obviously the community's religious beliefs and practices, the environment, so community's infrastructure, which includes the homes, the water sources, waste disposal sites, and also businesses and shops and considerations related to occupational health. Communication, so they look at the native languages and the types of communication that the community uses. If we're looking at Africa, they might not have access to the internet or just Facebook. Sometimes they don't even have Wi-Fi. So looking at if they use letters or telegrams, and even in a hospital setting, if they have an electronic health record. Next, we look at education. So level of literacy, government, how community is governed or ruled. There's some countries in South America that they're in an uproar. Community is kind of disrupted because of the government, and if there's no help, it's almost like an uproar. Family support, access to care, which includes 3 different areas, which is gaining entry into healthcare system, geographic availability, and also finding a healthcare provider that patients can trust and communicate with. Safety, examining potential dangers and if there are any plans to kind of prevent any injury. Transportation, how community members travel from A to point B. Sometimes cars aren't readily available in other communities. Economics, so the efficacy of economic resources in terms of productivity, dispersal, and expenditure. Health status and health behaviors, such as Gray, Tennessee, where we actually implemented the RAM model. A lot of the people there smoked, so that was something that we kind of found that we could teach them, encourage them to stop and to kind of help them decrease their chance at developing some other health issues associated with that. Recreation, so relaxation through sports, hobbies, what they like to do, and technology. And I've kind of already talked about that. So once the needs are identified and intervention can be chosen to be implemented, and so we chose the RAM model. And so Trina's going to talk a little bit about that.
So the mobile clinic model, according to research, the model clinic is effective in an intervention that provides the following services. So that's preventative health screenings, chronic disease management, and urgent care needs. Mobile clinics are effective at reducing health costs, addressing the barriers of healthcare, providing access to the community, and establishing trusting patient-provider relationships. RAM, known as Remote Area Medical, is a mobile clinic that provides medical, vision, and dental services across the United States. With the aid of community and national volunteers, everything RAM provides is free and it's volunteer-based. So regardless of your insurance, your ethnicity, your gender, residency, region, and religion. RAM was established in 1985. RAM has a corps of 135 humanitarian volunteers have treated more than 785 women, men, and children, and also pets as well, delivering over 135 million worth of free healthcare services. So we're going to present to you a short video. And in this video, you're going to see our experiences with RAM in Grace, Tennessee.
So remote area medical was a very eye-opening experience, and it was a life-changing experience. Even though we think that United States and Americans are particularly healthy, and we're living longer lives, we still have disparities. And being part of RAM helped me to understand that we as community, we can use our skills to help the people who need it. So today we're here to raise awareness about healthcare disparities in the United States, and this can be done by socioeconomic status, race, gender. So we need to work together as community leaders, as government agencies, and educational institutions to help organizations like RAM to reach their goal. By providing free clinics, we are helping increase the number of people who are receiving healthcare. And by doing that, we are decreasing the number of people with chronic disease in the United States. Individuals who receive help in RAM in Tennessee, they were very grateful. And I think that's the part that very touched me. So even though, and we still have many issues in the United States that we need to address. So to help you to understand how to use the ICANN model to analyze this issue, we're gonna do like a group section. So we're gonna go and use an article that was recently published by the US News Report. So according to the World Health Organization, health disease are the #1 cause of death in the world. Also, if you look at the last 2019 American Heart Association report, 48% of the U.S. adults aged 20 and older are living with cardiovascular disease. 45.6% have high blood pressure, 37% have pre-diabetes, and 9.8% have diabetes. 15.5% of adults smoke, 39.6% are obese, and 7.7% have severe obesity. So we have to consider that so we can start working on our case.
The case study is written by Caitlin Newman of the U.S. News and World Report. This was published January 31st, 2019. Nearly half of American adults have some form of cardiovascular disease, a new statistical analysis from the American Heart Association finds. The group's annual heart and stroke statistics report, published Thursday in the organization's Circle Journal, compiles the newest, most relevant statistics on heart disease, stroke, and cardiovascular risk factors, such as smoking, a release on the report says. Data were gathered in conjunction with the National Institutes of Health and other government agencies to create a comprehensive examination of the country's heart health. The report showed that at least 48% of all Americans, about 121.5 million people, had some type of cardiovascular disease in 2016, and that the number of associated deaths grew from 836,000 to 840,000 in 2016. The organization says the increased prevalence of cardiovascular disease seen in the new report was mainly driven by a change in the definition of high blood pressure in the 2017 American Heart Association and American College of Cardiology Hypertension Guidelines, which lowered the threshold for high blood pressure to 130/80 from the previous definition of 140/90. Normal is 120/80. The cardiovascular disease category is comprised of coronary heart disease, stroke, heart failure, and high blood pressure, the organization says. With high blood pressure removed from the equation, cardiovascular disease prevalence among American adults was 9% in 2016. As one of the most common and dangerous risk factors for heart disease and stroke, this overwhelming presence of high blood pressure can't be dismissed from the equation in our fight against cardiovascular disease, says Dr. Ivor Benjamin, a volunteer president of the American Heart Association. Research has shown that eliminating high blood pressure could have a larger impact on cardiovascular disease deaths than the elimination of all other risk factors, including smoking in men and among women. About 80% of cardiovascular disease is preventable by managing high blood pressure, diabetes, and high cholesterol, the release says, while adopting healthy behaviors such as exercising and maintaining a healthy weight and smoking are also key. So again, we have this common issue that is in the United States, which is cardiovascular disease, #1 cause of death, and there are many risk factors that can contribute to heart disease, which would include obesity, smoking, all those things. Yeah, we would like to just kind of interact with you all and hear your thoughts on what you think could contribute to this issue, and we would like for you all to kind of just start thinking about, what are contributions to heart disease using the ICAM tool. So Trina and Rebecca and Sheila and I will come to you all and just kind of show you the ICAM model, which is a circle, and I don't know if you all have it in front of you.
Yes.
But we're going to go through that right